Welcome to the Healing Grove podcast. I'm Dr. Kristen Ryman, an integrative holistic family physician, author of Life After Lyme, and host in this virtual space of learning, healing, and growing. I believe humans are like trees, and our physical limb is only one of many. Health on all limbs of the tree, emotional, conceptual, social, spiritual, is absolutely required for the whole tree that is you to be vibrantly well. I created the Healing Grove podcast as a place to showcase some of the world's best integrative and holistic medicine, to expose you to transformative tools and mindset shifts for all limbs of your tree. I hope you enjoy our conversation in the Healing Grove today as much as I enjoyed having it. Welcome, everyone, to the Healing Grove podcast. I'm your host, Dr. Kristen Ryman, and I'm delighted today to introduce you to my friend, Dr. Tom Meade. Hi, Tom.
Hi, Kristen. Thanks for inviting me.
You're so welcome. So Tom and I know each other, not just because we're physicians who trained and worked for some period of time, overlapped in the same hospital system, but actually because we met at the pool. Tom is an avid master swimmer, and many of you know I've taken back my love of swimming in the last 2 years. And so it's been a great delight to meet so many wonderful swimmers and remember my swimmer culture and heritage and meet people like Tom. So I'm going to let Tom introduce himself, but for the short part of it, Tom is an orthopedic surgeon. He's also a person who cares deeply about whole person health. So even though bones and joints are his kind of jam, he's also really interested in the person who's walking in on those bones and joints that might be ailing them. So I love what you're doing, Tom. I really wanted to bring you on the podcast so you can share kind of what your journey has been like through orthopedics and beyond, and also talk about all the different cool stuff you're doing education-wise these days. So welcome.
Thank you. And it was always great meeting you. And when we meet in the pool, just by history, our first common denominator is we get in the pool, we say hello, and we swim. And I think we swam for a while before I even knew you were a physician. So I certainly knew you as a tall, athletic, born to swim type of person in the pool. And then some of our colleagues said, "Oh, Kristen is a physician too." And that sort of started our other conversation poolside about some things we have in common. So it's always cool to have an athletic history. It's definitely a certain bond that we have, and then we expand into other things where we cross over in common. So it's cool meeting you, and it's cool having conversations about many things. And I'm impressed with your history in medicine and your journey as how you sort of came from one of the most traditional and biggest medical education institutes in the country, as do I. And now we're sort of both converging on things that make a lot more sense than we were exposed to in medical school.
Yeah, well said. Well said. And it's funny because, when I learn someone's a doctor, my first impulse is to be a little bit wary,
Yes.
which is really sad. I mean, this is our original tribe, right? Our professional tribe. And it's so sad to me how many of them are so burned out and so stuck and so locked into this way of thinking about health and healing and illness, even that it almost makes this sort of shared pool of meaning, which could be so vast and enriching, difficult to traverse.
I agree.
Yeah. So tell us, I want to hear a little bit about your story of how you came to orthopedics for one. I have a son who just got into medical school and is considering orthopedics. Yeah, I keep telling him to reach out to you. Maybe he has already, I don't know.
Oh, yeah.
But I'd love to hear kind of what drew you to that field, what you love about it, kind of what the ups and downs of your medical education have been, because I think they really will paint a good background for where you are today.
Oh, a lot of it goes back to where we grew up and what influenced us. And, I grew up in northeastern Pennsylvania. My parents were not physicians. I really had no exposure to medicine whatsoever growing up. I was a pretty healthy kid, never really had to go to the doctor a lot. So, I had a moderately accomplished swimming career in high school. I was actually a diver. I really hated swimming. It was way too much work. it was so much fun to bounce on a diving board and do flips and that sort of thing. So anyway, I did, pretty well in high school and diving, and I was good in math and science, so I had no clue what I wanted to do, except that Penn State recruited me. It was the only school that recruited me, and I went to Penn State, but really not to dive. I thought I was good in math and science, and I was either going to be an engineer or a physician because that's all people that were good in math and science did. And so that's sort of what led me to Penn State. In my first year, I lived with a lot of engineers, and they were really good in math, but they were not really good in biology. And I said, well, I'm pretty good in both. So I think I was looking more into medicine, not having any experience, than as opposed to engineering. And then, I dove for a couple months with the Penn State team, and they decided they weren't going to offer any scholarships until the next year. And then I said, well, I'll come back the next year because I don't think I'm going to make a living diving, but I think I need to spend some time getting into medical school. And then I dislocated my shoulder.
Mm.
And so, ironically, just sort of an athletic event that I ended up needing surgery after my freshman year. And I met this great orthopedic surgeon in Scranton, Pennsylvania, Joe Caesar, and everybody loved him. I was just always enamored by his patient skills in the office. He was always 2 hours behind, but nobody minded because he had such a great personality. And that really was the signature event that convinced me if I'm going to go into medicine, then this looks like a great field. And as an athlete, sort of directed me into sports medicine. So, that was the first step in after I got into medical school, and that prompted me to say, if I get into medical school, this is what I want to do, to go into surgery, but orthopedic surgery. So it's sort of an interesting history of how things just unfold and change your whole life. An injury changed my whole life and my interest in medicine.
Wow. Well, I mean, I work with people who have such debilitating medical journeys that they're going through. And often on the other side of that, their whole lives are changed through their medical illness too. So yeah, it is powerful, especially to meet someone who's so kind of resonates with you, as a person or a teacher or whatever that doctor did to kind of help you get through that chapter. Sounds
Yeah.
like very inspiring.
Yes, absolutely.
So what happened next?
So the other cool Sentinel event is in medical school. I was at Jefferson, and the first 2 years can be pretty rigorous academically, and then everybody looks forward after your freshman year to having a break in the summer. And in Philadelphia, a lot of people grew up around Philadelphia. Their goal is to go down to the Jersey Shore. That's how they measure success in Philadelphia, is sort of having a job or going to the shore. So um, I needed money. So I needed a job, and I figured after my freshman year, I I wanted to figure out if I really liked surgery. So I walked into the surgical department a month before summer, just walked into the first office that was open. A secretary was there, and I said, "Listen, are there any jobs in the surgery department for the summer? Because I'm looking for a job and I want to get some experience in surgery, see if I like it, make some money, and stay around here." And ironically, she said, I'm a secretary for a brand new surgeon that was brought in at Jefferson to start a kidney transplant program. And she said, he's starting a lab to explore kidney transplants, and maybe he needs an assistant. And so just by luck, I walk in, and I met with Dr. Bruce Jarrell, who ultimately became very famous and very accomplished. And so you may not like this story, but he was opening a research lab which requires animals and mice and rats and even bigger animals to do kidney transplants on. And so literally, I was a freshman in medical school, hired, and he was starting the first kidney transplant program at Jefferson, which is now enormous and has expanded into liver transplants. But literally all summer, I did kidney transplants on animals and did research. And I said, I'm a freshman. I can't do kidney transplants. He goes, Tom, it's not that hard. And literally, he showed me in weeks how to sew vessels together, ureters together, do transplants. And so all of a sudden, I had this enormous skill set as a freshman that fellows and residents didn't have. So for the whole summer, you know, if you want to be good at basketball, I always said you could go down to the basketball court on the corner and play basketball for 8 hours a day. If you want to be a good surgeon, you can't go and operate in your basement and become good. I had this, I look at it like, the Bill Gates theory of how he and Jobs became good in computers in the 50s. They were at the right time at the right place when nobody else had access to writing software. And so, as opposed to my peers, we're all pretty smart when we get into medical school, and it's hard to differentiate yourself academically. Back then you got graded. Today it's all pass fail. It's even harder to differentiate yourself, which is another story. But so yeah, after my freshman year, I mean, literally you realize you have surgical skills. And then when you get into your third year, you obviously stand out, maybe not because you're better, but because you've had access to operating. And I just absolutely loved it. And because he was starting a kidney transplant program, he was on Kidney One harvesting team. And so he was brand new, and I just got indoctrinated into his program. So he would get a call, there's a harvest to do in Ohio or Scranton, and he would call me my second year of medical school, and I felt like an all-star. I would leave, my pathology class and meet him in the surgery office. We'd have a car drive us to the corporate jet center in Philly airport. We'd fly to Scranton, and now I got to operate on real people. They were still alive, but they were obviously donated their organs. And so, it was just an amazing experience that advanced me so far ahead of my classmates for surgical skills. And really, that's what got me, into some of the best programs and fellowships in the country. Just happenstance. I didn't want to go to the Jersey Shore. I needed money, walked into the right office, got the right job, and it changed your whole career.
Yeah, amazing. Well, and the piece that I think is important here above all is that you were willing to ask a question. You were willing to sort of humble yourself and say, I need something from someone else, right? I'm looking for a job.
Yes.
That's the key, right? Wouldn't have landed in your lap if you hadn't been sort of looking
Right.
with hands outstretched to say, what's here for me? How can I
Yes.
find a place here? That's amazing.
That's
Wow.
cool.
I'm guessing because I've been to medical school and I know sometimes when someone's head and shoulders above the rest, there can be some feelings among other classmates of disgruntlement, to say the least. Did you ever experience any of that, or were they just super psyched for you?
Well, you know what? It wasn't disgruntlement with my colleagues, but it was maybe disgruntlement with senior residents and fellows because Bruce Jarrell, um, who ultimately became chairman at multiple places and even president of the University of Maryland. He had a great career, but he was sort of proud of me as a freshman, and he would bring his transplant fellows and say, Tom, I'll show you how to do a transplant on this dog or something. And so he, so, you know, so it didn't bother me because they weren't my colleagues, but it was pretty cool. And then I'll tell you one other interesting story. So the Rosado brothers controlled surgery in Philadelphia. One was chairman of surgery at Penn, and Frank Rosado was chairman of surgery at Jefferson. So this is like, the mafia of surgery in Philadelphia. They controlled it. Well, when I started the lab with Bruce Jarrell, um, he asked me if the chairman's son, Ernie, let's see, yeah, Gary Rosado, who was a high school junior, could work in the lab with me. So now I have the chairman of Jefferson coming in and saying, Tom, I know you're working with, would you mind if my son in high school wants to go into medicine, could work in the lab? So now Bruce teaches me how to do surgery. And I have a high school student who is the son of the chairman at Jefferson. And so the amazing doors and opportunities that open are phenomenal. And fast forward decades, his son became the chairman, got into Jefferson, became a surgeon, and then he himself became chairman of the colorectal department at Jefferson from a high school student. So
Wow.
his story
Wow.
is just fascinating.
So I'm really curious about how you ended up in orthopedics. Obviously, it's a surgical specialty, but you were really doing transplant
Vascular,
surgery and
vas
vascular surgery, which is very
vas
different.
So it's a great story. So really, then, I went through my second and third years, and then I rotated through the orthopedic department with Jerry Kotler, and I just loved orthopedics and I loved vascular, but I looked at it and you don't have to be in too many 12-hour liver transplants or these kidney transplants that start at 8 at night. And then I did vascular surgery, and a lot of the vascular patients, they were just older metabolic disease. And I was really into sports and athletics. And I said, I really like orthopedics. And ironically, it was a fight with Bruce Jarrell because I had to ask him for a letter of recommendation to go into orthopedics. And he told me I was wasting my career. He's going, Tom, he's going, you are way too skilled to go into orthopedics. He says, you're wasting. I go, Bruce, I love it. And I'll tell you, it's an interesting story to go full circle to get in. I got applied to Jefferson, and he wrote me the most outstanding, glowing letter of recommendations and said, my only regret is Tom is not going to be a vascular surgeon. And then Frank Rosato wrote me a letter because, so the two biggest letters I could get, it was almost like a shoe-in to Jefferson. Fast forward. I hooked up with Bruce Jarrell recently. Had to step in as the he was the dean at the University of Maryland, and then their president stepped down and he was the interim dean. But this guy was the single most talented surgeon, human being I've ever met in my whole life. He was an athlete. I'd play racquetball and he would kick my butt in racquetball. And he was a blacksmith and he was a fine carpenter. He invented one of the kidney transplant dialysis machines. And he was so good with his hands that when I went into orthopedics, it wasn't quite as exciting as it is now. They were called bone setters. We were putting casts on, and we didn't have all the cool advances. I told Bruce recently, I said, Bruce, you missed your career. You would have been a much, much better orthopedic surgeon with your ability to innovate, make things, blacksmith. Orthopedics is so exciting in the last 35 years. And so we both sort of looked at each other through different lenses. He looking at me as it was a primitive specialty. Now it's one of the most sought after specialties because of design considerations. And so it's just a great story.
Yeah, wow. How wonderful to have a mentor and a friend who spans so many decades with you and who kind of is on that journey of, you know, becoming a physician and really reaching great heights, both of you in your field.
Yeah, you just look at, life, you just don't know what opportunities are there. You just have to knock on doors, and when they open, you always have to be aware of opportunities. People would say, you're lucky or this happens, but you just have to have a knack of getting up every day and having a goal of, being a surgeon or being an orthopedic surgeon and just look every day at opportunities that might help you along that road. And then it happens. It just doesn't happen without, some focus.
It reminds me of something one of my chief resident, who was my surgical resident when I was doing my rotation at Stanford, and he was actually going and he was training in general surgery, and then he was going to do fellowships in vascular. And he said to me, Kristen, remember this: learning happens at the crossroads of opportunity and preparation,
So
which
yeah,
I thought was is exactly what you're talking about. Showing up ready to learn, and you show up and there's an opportunity that happens for you.
yeah. No, I just every stage in my life, I just look at, you know, opportunities for when I was 11, I needed money. My dad was a state policeman and, I always thought we had everything we wanted, but there certainly wasn't my handout asking for spending money. And one of my friends had a paper route. He was 2 or 3 years older than me. And, I would help him every day deliver the papers. And I think gave me 50 cents every 2 weeks or something. But you had to be 12 to have your own paper route. And I just remember I was 11 and a half and he wanted to give up the route to me. And we had to lie and say I was 12, but I didn't even look 12. And, again, it was just an opportunity. I said, well, this is great. I could have my whole paper route. I would make $35 every 2 weeks. And it was just looking for opportunity that even at 11 is there. And you just sort of have to look for things.
Yeah, you got to keep your eyes open and then show up.
Oh, yeah.
Cool. So, you've had a long career. How long has your career been so far in orthopedic?
Well, so it depends, what you want to say, I guess. Since 83, I accepted into the orthopedic residency program. So that would be 43 years, including training. Or, once I finished training and which was 6 years of fellowship and training, I've been in private practice now since 89. So, 30, whatever, 7 years or something. Yeah.
Yeah, it's a long time to do something. Do you feel, I mean, it seems like you still feel joy and excitement. Do you love it still?
Well, I love it because, I love it at different stages, and it's different now. I think we always think that it was sort of better when we trained and I got to do everything in orthopedics. The reason I went into sports medicine is it was one of the only deficits at Jefferson in our residency program. We're really good at total joints and hands and trauma, but they didn't have a big sports program because arthroscopy was not that popular. So, I felt I had a wide breadth of education at Jefferson, but at that time, not everybody was going into fellowships when I finished. People wanted to get out, get a job, make money, pay their loans off. And really, I was in the same position, didn't have a lot of money, and fellowship really didn't pay you a whole lot. I actually had to take a pay cut. I still remember. I think as residents, we were getting 26,000, which was pretty good money at the time. And then I was married and had my first son, and I moved to Cincinnati to do a fellowship in sports medicine with one of the gods of orthopedic surgery, Frank Noyes. But he was only offering $22,000. So I took like a $5,000 pay cut, moves across there. But I knew in the long run it was the right thing to do. So I got out, I did my internship at Lehigh Valley, which at the time was the first biggest and best level 1 trauma center in Pennsylvania. So really exciting when you're young doing trauma, you just became a good surgeon. So, back then I could do trauma, sports, total joints. I did a 6-month hand fellowship somewhere in there also, and then decided I didn't want to do, it's another story, but I didn't want to do hand, but you could do everything, which is what I thought I wanted to do in orthopedics. And, over my career now, at the end of my career, I do one operation, I do knee replacements. So your whole um, skill set has converged onto one single thing, which I think is good for me now to have such a breadth of experience. But training is different now. Like you can't do what I did back then because nobody gets that breadth of experience for a couple reasons. They don't do as much surgery as we did as residents because they have the time rule. So theoretically, you can't work more than 80 hours. When we were residents, it was always a badge of honor to, not sleep for 24 hours, be on call every second or third night, and those sorts of things. It's probably better now for your quality of life. And I think culture has changed. People look for more lifestyle now. They want to have balance. And back then, it was really like an indoctrination. I mean, you really were programmed that this is what life was like. And but you learned a lot. You got a lot of surgery, and now the rules have changed. A lot of the residents get through. They automatically have to do a fellowship because they don't have the experience or the hours, to quote Malcolm Gladwell, to get 10,000 hours of experience so you can become an expert. So there is a big difference in I see the kids, young surgeons coming out now. It takes them a longer period of experience in their practice before they achieve excellence that a lot of my colleagues achieved earlier because of the amount of hours able to do surgery. Sort of interesting.
Right. Unless they're doing, rat surgery,
Yeah.
unless they're doing
Yeah.
transplants in their basement.
But they come out now as specialized in one thing, and that's, I guess it's good. But they come out now just doing sports medicine, just doing hip and knee surgery. So they're good at that, but they really they can't, if that's what they do, you don't want them at a level one trauma center at 2 in the morning doing things. So the whole culture, I guess, has evolved for the better, but there's always pros and cons of each way we were educated in the modern education.
Sure. Although it's interesting because, Tom, you've also really focused up. I mean, despite this breadth of training, knees are kind of your main jam now, correct?
So it's interesting. I've always done knee surgery, but early in my career, I would say I did 80% sports knee surgery, ACLs, arthroscopy, PCL, reconstructions. But because I trained at the Rothman Institute, really world famous for joint replacement, I was also pretty good at joints, but it might have been 20% of my career. As I've aged, my patients age. So my sports patients got older and their ACL joints became arthritic joints. And, I became 50-50, 80-20. And really, over the last 10 years, focusing on just total knee replacements, I've sort of developed a speaking and research niche. And so I work with implant companies in design contracts. And so that's been exciting too, using my experience to be able to further the space, the industry. So I'm working with several companies designing the next generation of cementless knee implants. And so there is value to just doing one thing and having over 10, 20, 30,000 hours of just doing that. I've done 24,000 knee replacements. So that skill set allows me to give back as long as I'm capable. And that was sort of one of our opening statements. You have all this experience. I just don't want to stop and plant flowers in my garden and not be able to help translate that wisdom and experience.
Yeah, I feel like that's maybe a personal dig because, I really enjoy planting flowers in my garden, Tom.
I'm terrible at it. But I want to swim, but I can't swim all day. We get pretty tired after an hour.
Yeah, yeah. No, we go hard. So I want to hear a little bit about, I know that you've got some patents in your name. You've developed a lot of fun and funky things for joints. Like what's the thing you're most proud of or excited about that you've
So,
created?
so it just, it almost goes along our conversation. So, um, when I was at Jefferson, we were part of the first Jefferson triathlon team. So we used to do a lot of triathlons then. And so we also did a lot of biking. And so I lived in Bluebell, which was 19 miles from Jefferson. So I would ride my bike to Jefferson. It was 19 miles as a way to get workouts in. And so, when I wasn't on call, that was 38 miles a day. So I ended up doing a lot of biking. So I was pretty good in biking and swimming. So when I got into private practice in Allentown, we have one of the biggest velodromes in the country. So I became the team physician for the velodrome and cyclists. And so I would cycle with them. And then one day I was in an accident and a car drove me off the road and I broke my clavicle. Literally broke my clavicle. And as a trauma surgeon, we would fix clavicles in patients. But in orthopedics, we never fix clavicles because they told us it was wrong. They all heal and do well. But I knew from treating the velodrome professional athletes, amateur athletes, if they broke a clavicle, we would operate on them, fix it, put a plate on them. They were back on the bike within a week. And so I said, as soon as I fell and I knew I broke my clavicle, I called my partner and I went to the ER. And that night I had him plate my clavicle. And so I was back operating on Monday, 2 days later, because I could do it. A week later, the plate broke because he put a plate. There were no plates designed for clavicles. This was a plate designed for a fibula. So it broke like a paper clip because flexing back and forth, it broke. And so a week later, he put another plate on me, which was 3 times as thick, which was great, but I could feel it under my skin. It was that thin. So I said, this is crazy. And so it started me on a route to develop a clavicle plate. So I developed what's called the universal thin clavicle plate that was thin on the edge and thick in the middle. It was a combination of the two plates that were in me. So that was the first patent that I made. So I developed this clavicle plate so it wouldn't have to be removed and it wasn't too thick under the skin and it wouldn't break. So really, that was probably, I do knees now, but that's one of the most proud I am of a patent I have. Again, because of an opportunity, broke my clavicle and I don't like the what was out there in industry and I developed a clavicle plate.
That's a great story.
Yeah.
Wow. I'm glad you weren't more injured. I mean, that sounds like it could have been much rougher.
It was crazy. It was literally 10 mile an hour. A car rode me right off the road, and the road was just resurfaced, so they didn't have it tapered off to the shoulder. So it was like a 4 inch drop off. And it was like I was a gymnast on a balance beam. This car is pushing me off the side, and I'm trying to balance, and those thin wheels, it just went off the 4 inch, and I tipped over, landed right on my shoulder. So thank God it wasn't a 40-mile-an-hour crash. It was literally 5 mile an hour falling right on. And as soon as I hit, I knew I broke my clavicle.
Man, yikes. Well, it's good that you had your tools in your back pocket of like knowing what was happening and you had
Yeah.
access to, yeah.
Yeah.
Wow. So, innovations in, you know, parts are one thing. You've also been an innovator in terms of structures and systems of medical care, right? Tell us about I know you were a founder of one of the bigger centers for orthopedics in this area. Can you talk about that a little bit?
So, yeah, so I was in private practice and one of the aspects of being a sports medicine physician was exercise and therapy. And I had a relationship with the Medical Fitness Association. And so that was in 1994. And there was this void between patients that would go to physical therapy and then they would go to a gym because there's an intermediate phase where the expertise is not there. So the Medical Fitness Association was this great association I got involved with in the early 90s. And what they would do is they thought that medical fitness should be more than a gym. You should have criteria, evaluations, look at people's medical and physical profile, and they develop forms and facilities around the country. And they were mostly at hospitals. So hospitals, all of a sudden, the early 90s, there were some progressive hospitals and this is an interesting story, that were into medical fitness. And I wanted to start a medical fitness program at Lehigh Valley Hospital. I still have the letter I wrote to Elliot Sussman, who was the CEO. And I said, Elliot, he just came here. He was trained at Harvard, Penn, and Yale. I don't know if you're familiar with any of those institutions.
I might have heard of them.
Yeah, I may have heard of them too. I don't know. I think they're pretty good. But he had this great legacy, and he sent out a letter like an incoming CEO, and he said, "Tell me what you think we could do to contribute and improve the Lehigh Valley Hospital network." So I sent him this big letter, and I said, "Why don't we become a center of wellness instead of a center of illness?" And I said, to do that, we just don't want, so it's sort of interesting. I don't realize, then, but I was really looking at how hospitals are not great places. They do nothing for prevention. They want us to be sick, and they're very good at treating us once we're sick. I said, why don't we look at what the Medical Fitness Association does? And they were looking at these places around the country, and it was dismissed. It was dismissed because who would want to be a center of wellness when we could be a center of illness? What was I thinking? And
I
so,
had this moment of hope that you were going to tell me, Elliot, was like, great idea. We're an innovative. I mean, he was in charge when I got here as a resident, and I
yeah,
remember I remember I remember sort of the branding and things that happened during that time. But gosh, I had a moment where I was like, did
yeah.
Lehigh Valley do the right thing? Okay, maybe not.
So it sort of forced them to do the right thing over time. And so to your question, um, I I was looking to, we just hired some new people. I did have a medical fitness center. We actually won, myself and John Graham. I brought him in as the director. He came from Erie, and we started the first medical fitness program privately, not associated with Lehigh Valley in the Lehigh Valley. I needed a bigger facility. And then um, a plastic surgeon friend of mine introduced me to a construction company that had some land in Allentown and said, here's, how we could build a bigger facility. It wouldn't cost you more than the square footage now, et cetera. And so long story short, we built this 300,000 square foot medical campus called the Integrated Health Campus, which if you drive up the turnpike is really the gateway to the Lehigh Valley. It's still there. And truth be known, don't tell anybody, but the biggest reason I wanted to build it was to have a swimming pool. And so the only reason I would design it is because I wanted to have a swimming pool and for lap swimming, but that doesn't make any money. So if you want to have an aquatic center, I had to build an aquatic therapy program, an activity program, and I got to put in a 4 lane, 25-meter pool. I couldn't get 6 lane, and it could have been a yard pool. I go, listen, if we're going to go 4 lanes, I want a meter pool. At least give me some length. And so that was the basis of building this huge center. And then the pool became part of the medical fitness facility that Lehigh Valley ultimately partnered with me. So
So
they,
you're talking about the one that's up on Citronia Road that
yes,
we used to call the Taj Mahal because
yes,
that one, that
yes,
huge,
that's
yeah.
huge.
They
Yeah.
had other names, right? They had the center for they had something else.
So the global name is still the Integrated Health Center. And now it's Steel Fitness
Steel Fitness.
Premier. But before that, it was the Human Performance Center.
That's the one. And that's the one that you could get as a resident. I had a
Yes.
membership there because you could
So
get a
see,
discounted.
all of a sudden they said this has value. Maybe we should partner with Tom Meade over here. And fast forward that, so we partnered with them. Ultimately, they built, modeled after that, the Lehigh Valley Fitness Center downtown Allentown. So if you go downtown, it's exactly a replica of what we did. So despite Elliot initially having other things on the plate, and I don't blame him, you didn't make money being a wellness center. So what we started the first medical fitness center. Now everybody has one. St. Luke's built a huge medical fitness center across the street from the Citronia building. And you know who is the director of that? John Graham, who I brought in from Erie, and we partnered. But as we grew, they needed actually, a director. And I talked to Rick Anderson personally and said, you got to hire John Graham. And they said, well, we'll compete with your program over there. I go, it's not about competition. It's about increasing medical wellness in the whole valley. He's the best guy to do it. And if you look at Citronia Road and medical fitness, it's probably one of my most proudest accomplishments of what we did was bringing medical fitness to the valley. Even I think it trumps any accomplishment I have in orthopedic knee surgery.
Wow. Well, on behalf of myself and everyone who's used that beautiful facility, I had no idea you were involved in that or even basically started that. Thank you. It's
Yeah,
amazing. It's
yeah,
amazing. And I love the intention behind it and the collaborative nature of how you are just trying to improve wellness here. Such a great story, Tom.
Yeah,
Cool.
cool.
What other fun, crazy things have you done that I'm should be grateful for that I don't know about yet?
Um,
You
it's
don't have to answer that. We'll get to it. So
yeah,
here's my question.
yeah.
You are clearly an out of the box thinker. You're always looking for opportunities to make the world a better place, make your specialty a better place, make better tools and devices for surgeons and for patient experiences. How does that sort of way of being that you've described through all these activities translate into what you're doing now outside of outside of your clinical care? You're doing a lot of other things. So tell us
Yeah.
about those things.
So it just gets me up in the morning. I get up every morning and I'm thankful for my health. I'm thankful for giving me skill sets and talents that, I can do what I want to do and help people and, advance things. So, and I never stop looking at opportunities. And maybe um I just backed off a little bit because time is one of the most valuable commodities we have and it's limited. So, I start taking Fridays off now. So, and it's not like it's off and I, you know, I take Fridays off to work on things that are really cool for me. But, and even though they start orthopedically, I mean, orthopedically starts with our body and our health, but it just opens these doors of things that I want to learn about and know about, and then translate that to patients and friends and I've become a mentor to a lot of my friends in different social circles and of course they ask me about orthopedic things, but they're always asking about other health things, and they see me wearing glucose monitors and say, I'm sorry, you're diabetic. And I go, I'm not diabetic. I said, I just think this is cool and I want to learn about it. And I learn, how my activities and stress and working out and at work changes, blood sugar levels that have nothing to do with a one-time fasting blood sugar that patients get once a year. And I get my blood sugar checked 280 times a day, by a monitor. So it's just like these cool things that open up that allow me to just go in many different directions.
Yeah. What's your current interest right now? What are you fascinated by right
So
now?
I'm fascinated by the endocannabinoid system. Which is a great system. And I'll tell you how that started. In 2016, um, Pennsylvania was looking to legalize marijuana, cannabis. And so a bunch of my surgeon friends, head of pain management, Jefferson Rothman guys said, why don't we look to get a license for medical cannabis if, they're opening this door and I knew nothing about it. And so I started to learn about how cannabis works and the endocannabinoid system. And I was fascinated. And probably for good, we were the only license application to Pennsylvania that was all physicians, smart guys, surgeons, um, and pain management people. Our heart was in the right place, but our money was not in the right place because we didn't pay anybody off. We had no lobbyists. And so we didn't get a medical dispensary license, which was probably good. But what it did do is it opened my eyes to this endocannabinoid system, and I did a deep dive into it. And so for, the last 10 years, I have learned more about a system that is in every animal. It's millions and millions of years old. It controls every physiologic system in our body. It's so important in homeostasis, and I don't know about it. And I didn't learn about it in medical school because the system was never really discovered until I was done with residency program in the late 80s and 90s. And I said, well, that's an excuse. But even today, very few medical schools will teach it. They don't have enough room in their curriculum. There's political reasons. But so I'm just fascinated by this. I've immediately incorporated it into my perioperative um, medical multimodal pain approach because we were so much partly responsible for the opioid crisis. How embarrassing for us as a profession. I mean, we could go through that story for hours, which is just embarrassing. And we were convinced and told by the powers that be that, pain is the fifth vital sign. We have to do it. Opioids aren't addictive, especially the OxyContin. The whole Sackler story is terrible. And so this started me on a road to non-opioid treatment of postoperative pain. And literally today, half of my patients take not one opioid medication after a knee replacement, which is crazy. When I trained, we had morphine pumps. They were screaming in pain. We had no other multimodal pain approach. But understanding the endocannabinoid system, inflammation, pain, CB1 and 2 receptors has been an intrinsic part of my non-opioid approach. But it has so much more to do than just pain. It controls all these other systems in our body. And every year I learn more and more about, and I became an invited speaker nationally and even internationally. I just got back from Dubai where I was speaking on the endocannabinoid system to orthopedic surgeons around the world. So it's such a great interest of mine, just learning and teaching that.
So
Pretty cool.
cool. As you were talking, I had this memory of being in the hospital. When I had Lyme, I had this a couple years of just excruciating back pain, sort of radiculopathy, sciatic nerve. And I was in the hospital for a week at the beginning of all that. And ultimately, they couldn't control my pain. And so ultimately, I was put on a morphine PCA, a pump,
Yeah.
and it wasn't working. So they switched it to Dilaudid, and I overdosed. And I had like a Narcan crash cart come in and had
Ah,
to get like, yeah, so scary.
it is
And
scary.
that's not like an unusual event. Those things are super, and for certain people who just don't process it properly or who are rapid metabolizers or
Oh,
slow metabol, like you can get into all sorts of trouble with those drugs that are just not,
they're terrible.
yeah.
I've almost, I'm almost became a pseudo anesthesiologist because almost 90% of all my patients go home the same day, and I've had to learn um, the drugs that anesthesiologists use, both in spinal and injections. And I've insulted a lot of them because I've had some great anesthesiologists I've worked with, and we figured out how to individualize even spinal medications because they follow this cookbook of how much Novocaine type of medicine per kilogram of weight. And to send patients home, we're very efficient. I do one operation, doesn't take me very long. So I want a 1 hour spinal that wears off. And the typical spinal lasts 8 hours that they would give patients. So automatically you had to admit them to the hospital. You had to put a Foley catheter in because they couldn't pee. And so I slowly learned by titrating the dose down and the different concentrations which spinals work to last 1 hour so my patients don't need a Foley catheter. They can get up and walk. And so it worked at one place, but I operate at 3 or 4 different hospitals. When I went into a new place, the anesthesiologists were insulted that I would tell them what dosage, what medication to use. And they said, well, we can't do that. That won't work. The patient's gonna, quote, wake up or the spinal's going to wear off in the middle of surgery. I said, no, it's not. This is what I know. And to that effect, I even in our own profession, they get focused on their protocols. But to your point, um, when people say I can't tolerate anesthesia, I get sick to my stomach, it's terrible, nausea and vomiting. I said, cross out anesthesia and write in the word narcotics. I go, it's not anesthesia. You get sick because of narcotics. So I found out we can do surgery with no narcotics. We don't do fentanyl. We don't do anything. We use, other non-narcotics, Versed and Diprovan. And so I had to learn this whole process of telling anesthesia in a different facility in the OR, no narcotics, no fentanyl. And they would look at me and say, we have to. I go, you don't. And so as I learned that, the patients, they never get sick. They don't throw up. They get up, they pee, they don't have Foley catheters. And then to your point of Dilaudid, an anesthesiologist will write for pain in the recovery room, give Dilaudid. And I go crazy. I go, don't ever give them Dilaudid. The half-life is 8 hours. I've learned fentanyl, which is killing most people in the country, but medically, it's an amazing drug. You can give minuscule doses. And if you need a narcotic, it wears off in literally minutes, less than 15 to 30 minutes versus Dilaudid. So I had to learn the half-life of all of these narcotics, when to use them and when not to use them. But very few orthopedic surgeons have an interest, or they just allocate all of that knowledge to the team. But once I have a team that understands what we do, and they know my surgical team and skill sets are predictable. We're not doing 2 hour total knees where you need more narcotics. So it's a long answer to your sad story of giving you a medication that not only is it a high dose that lasts 8 hours and you can overdose on it.
Yeah, and nearly did.
Greatly.
Wow. Well, I feel like we're getting to the end of this. I want to know if there's anything that we haven't talked about that you feel like people who are interested in your story and interested in kind of the vast knowledge you've accrued over the years, and also the current learning edges that you're on. Anything else you'd like to share?
So, um, you know what? I love a lot of my colleagues just look at it. I have 5 years to go. I just want to retire. I like the operating room because it's like being in a lab, but office hours are so stressful because you're dealing with people, and I can't wait to get away with that. I look at them both equally. I love going in the office. I love seeing people, and it may not fit into the modern um, unfortunate medical industry where they want you to see patients every 10 minutes or 5 minutes. And fortunately, at my stage of my career, I don't have to do that. I could spend, 20 minutes or 30 minutes with a new patient. I have a tertiary practice. A lot of my patients are second and third opinions. They come from out of state. And how can you see someone that drove from upstate New York 3.5 hours to see you, and they have a 10-minute new appointment because the industry wants you to see patients every 10 minutes? And I just refuse to do that. But, the first 5 or 10 minutes in the office, I'm learning what the patient is like. They come in with the, Syracuse University hat on, and I'm asking them about the Orangemen and, why they're wearing that hat. And they played offensive line there and had, 3 operations, and what do they do? And, they drive you know, a delivery truck now, but they've had a career as a high school superintendent. And so all of a sudden you learn why they are there. They're not there for a knee replacement. They're there for you to improve their life through your skill set in improving their knee. But why do they want their knee improved? And they want it because they have grandchildren and they can't get up off the floor. And so it allows you to really be a life coach for these people and enjoy it. And so that's why I enjoy office hours and talking to people and developing relationships, which maybe not what we're sort of taught in medical school or the new medical industry of. So I've been able to sort of traverse that and do what I want and sort of understand why the industry has to make profit. Without profit, there's no mission. But still, I think the pendulum has sometimes swung the other way, Kristen.
Yeah, yeah. Well, it's beautiful to hear a physician after 43 years of experience still talking with such joy and purpose about the relationships that kind of fuel the fire. It's a
Yes.
long time to be doing something if you don't find meaning in it. And you've
Yeah.
clearly built meaning. It's
The
really beautiful.
coolest part is being able to, see a 49-year-old patient in the office last week and say, I walk in and I recognize the name, and he says, "Oh my God, Dr. Meade, it's great to see you again." I go, "Well, when did I see you last?" He goes, "Well, I played football for Parkland when I was 18." And he said, "You scoped my knee." I go, "Well, you have to be wrong because I'm not that old. That's not very possible." And you see these people that follow you through your career, and now he needs a knee replacement. But that's the coolest thing of actually being in one place for your whole career, I mean, they're definitely, docs in our facility in leadership positions, and they go through life and they move on like football coaches, and they have different academic positions. But and not to criticize that, but it's the coolest thing to be able to, treat patients through their whole career, their parents, and now their kids, their families. That's sort of a great opportunity.
That's really lovely hearing you talk about that because as a family physician, that's one of the reasons I went into family practice
Yes.
to follow families over time and grow old with people. And it sounds like you've been able to do that in your world too. And it's so
Yeah.
beautiful.
Yeah.
So how might people follow along with you? Let's say they know you and have been following you for a while, but also want to learn about some of the other stuff you're doing outside of the clinic, or new people who are interested in learning kind of alongside you on your learning journeys.
So, the hardest thing in sort of my profession, like I said, is allocating time. And now I have a little more time. So in the last year, one of the things I did was I engaged a company to develop a website for me that sort of gives a picture of everything I do. And so in one site, um, it allows people to go on meadandmedicine.com and sort of see what I do, not only orthopedically, but it, exposes them to some other things I've done. And it's one place where they could go and look at videos where I talk about 100-year, why is an orthopedic surgeon treating about, 100-year mistreatment of diabetes or obesity in this country? And so because it's related to my orthopedic patients, but I go, this is crazy. Insurance companies are denying my surgery because of some arbitrary obesity level of a BMI of 40 or a hemoglobin A1C above 8. It better behoove me to know more about obesity and diabetes and how we got here. And it starts me on this journey of going, well, let me look 100 years back and see, why did we get so obese and fat, and why are our diabetics now, type 1 diabetics are huge and obese versus before 1920, they were all skinny and emaciated. And so it just sends me on these journeys that I absolutely love. And then when I learn, I go, other people should sort of learn this. And I create some educational video. And anyway, a lot of that is available on that meadandmedicine.com site.
Perfect. So we'll link to that. We're also going to link to the other one that has lots of your videos, right? You've got this other company that has put out some of your videos too. So we'll put
Okay,
little sections of in the show notes so that people can find you.
great.
And of course, you're still seeing patients. You're still available. Are you taking new patients?
Yeah, we're very efficient at what we do, so we're seeing new patients because hopefully we're good at treating patients and then launching them on their life journey. So then it just opens up at the other end, new patients to come in. So we want to continue to improve people's life. It's like a reality TV show. I say every day in the office we could run a reality TV show with just pick any four patients because they are such interesting people. Oh my God. So can I tell you one other interesting story?
Yeah.
That's pretty cool. So, I saw this patient come in, and like usual, I walk in, he's sitting on the exam table, looks like he has a Vietnam vet hat on. See a lot of people, which I feel sorry for these folks that were vilified instead of treating our military now with respect and first seats on the airplane and thank you for your service. Back then, it was terrible. So I always respect those people. Walked in jeans, had paint on his jeans, and introduced himself. And I said, "Were you in the service?" I always asked him the first question. I always asked him about how, the Vietnam service, and of course he was in there. But I said, "What are you here for?" He goes, "Well, I need a knee replacement. I've talked to a couple people. You're my third opinion. I want you to do it." And I said, "Well, what do you do?" And he goes, "Well, I'm an artist." And he says, "I can't paint." And I said, "Really?" I said, "Well, how hard is that? You just stand at a podium and you sort of paint. I don't know that you need a knee replacement for that." And he said, "Well, I brought my portfolio so I could show you exactly, what I do so you'd understand it." And this is why I get behind in the office. I start opening his portfolio, and he's this unique, nationally renowned painter who's considered a photo realist because his paintings look like photographs, but they're realistic and real size, meaning real size. He would paint something like a Clydesdale horse, but it's the size of a Clydesdale horse. It's 12 foot long and 8 foot high. And he paints them with automotive paint on aluminum. One of the only people in the world, because he worked as one of the youngest designers in automotive history in his 20s by Pontiac, Cadillac. And he decided in his 30s, his real passion was painting. And DuPont gave him the only access to automotive paint outside of the auto industry, which he used to create these things. And so he has to get on scaffolds and elevators and climb up steps, and he couldn't do it because he had a knee replacement. So ultimately, I fixed his knee, and 6 weeks later, he was fine. I discharged him, and then he invited me up to his shop, which I went up, and we became great friends. And he showed me all of these amazing paintings. Harley Davidson commissioned him to paint, the original Harley Davidson motorcycle for their 100th year anniversary. So all of a sudden you walk in, and if you didn't ask the right questions about what they do and say, I need a knee replacement, I'm here for third opinion. Listen, we have an opening in 6 weeks. You would never develop these friendships and cool things of these people that come in that you think are unassuming, and they have their own skill set and are really world famous. It's a cool story.
Yeah,
And
amazing.
his video is on SSP TV. I actually brought him into the studio and did a two-part interview of his life, and he brought in some of his paintings and exposure to his studio. So it's really I mean, it's just cool.
Wow. Well, we'll link to that too, because I think
Yeah,
people want to watch that.
yeah.
Awesome, Tom. This has been so great. Thank you so much for taking this time, and also for just all the contributions you continue to make to the Lehigh Valley and beyond. It's been really fun talking to
Yeah.
you.
Yeah, thanks for the invite. It was great meeting you. And just, again, if we didn't meet in swimming and then know we were physicians and then didn't know you were functional and didn't know you had these podcasts, I mean, it just opens doors. That's the coolest thing. Thank
Yeah.
you. Great.
I hope you enjoyed this episode of the Healing Grove podcast. If you liked it, please be sure to like and subscribe. And if you want to deepen your experience further, consider grabbing a copy of the Healing Grove playbook. With journal prompts for this podcast and 41 others, it's the perfect place to record your learnings, keep track of the tools you explore, and reflect on your own experience. Finally, it's important to mention that even though I am a doctor, nothing you hear on this podcast, whether from myself or my guests, constitutes medical advice. Any intervention you try should always be discussed with and supervised by a trusted member of your own healing team. Thanks for listening, and see you next time in the Healing Grove.